Hi, my name is Barack Ozgur. I'm the Chief of Neurospine Program here at Hoag Hospital in Newport Beach, California. We have a whole series of lectures that we've given, other specialists at Hoag as well as myself, so check out the Hoag YouTube site for a whole host of various topics. We have a few topics on spine that I've presented before. Today's topic is talking about lumbar spine degenerative disease, and also its effects sometimes on the legs and where that comes from. So I want to kind of explain the pathology or the problem that occurs in our spines and what leads to this problem. And then we'll talk about some of the diagnosis tricks and some of the treatments, talking about minimally invasive options as well as non-surgical options. So what is degenerative disc disease? It sounds like something horrible, but it's actually extremely common. This is something that almost everybody will have to some degree. And it's something that is on a spectrum, meaning it's not something, it's not like a diagnosis like cancer. You have it or you don't. A degenerative disc disease just means that you have some tissues, some areas that are wearing down. So this is just a prop showing some of the spinal spectrum of degeneration. And as many of you know, that there's the bone or the vertebral body, and there's another vertebral body, which is the bone, and there's the disc in between. So the disc is the cushion between the bones. That cushion helps support our spine and keep the vertebral bodies, the bones, separated. And then between those structures, behind those structures are the spinal canal and the spinal cord that travels down the tube. And then coming out as like roots on a tree are the nerves. So these are the nerves, the spinal cord, depending on the part of the spine, it's spinal cord or more nerves that travel down, and then the nerves come out like roots on a tree. Now over time, just like our shoulders, our hips, and our knees will degenerate, our spines degenerate too. So that cushion wears down over time. Imagine your tire on your car. We lose air over time, and sometimes we have to reinflate to get that height. Well, our discs degenerate too, so we lose some of that disc height over time. Unfortunately, right now, we don't have a way to pump it up like our tires. Maybe sometime in the future or some new technology, but right now, what unfortunately happens is that disc wears down over time, so it's like we're losing air in our tires. And so the bones get closer together, and the space around the nerves starts to narrow. So as those bones degenerate, as the disc degenerates and the bones get closer together, sometimes the bones actually start to rub, and that can create back pain. It can happen in our neck too, and that can create neck pain. But when it happens in our lower back, a lot of times we'll generate low back pain. And the good news is most of the time that goes away. So we degenerate our spines over time, or with an activity, doing something we haven't done in a long time, lifting something heavy or twisting a certain way, we can hurt our backs. And that's because over time we're wearing down the discs, we're wearing down the joints of our spine, and that can create severe low back pain. But again, in most cases, if you rest and let it recover, it'll go away. So even though back pain is one of the most common ailments on the planet in terms of health problems, it is also one of the things that typically gets better on its own. The vast majority of people don't need surgery. So most people don't need me. I'm a surgeon. But to help make the diagnosis, you may see a physician like myself. Now, as those discs degenerate, sometimes we'll develop bone spurs. So on your imaging reports, like the MRIs, you may read degenerative disc disease. So again, it makes it sound like something horrible, but it's actually very, very common. And we'll all have some amount of degenerative disc disease over time as we get older. But sometimes we'll develop bone spurs. So the discs will degenerate, the cushion will wear out over time, and we may develop these little lips or spurs of bone. Sometimes they're called kissing osteophytes. An osteophyte is this ledge of bone, and as the disc degenerates and disappears, the bone spur from one edge and the bone spur from the other edge may actually touch. And that's why they're sometimes called kissing osteophytes. In any case, the most important element here is that sometimes you'll have an area where the bone is rubbing and creating back pain. Now, the other thing it sometimes does is the spinal canal is that tunnel where the nerve is passing through or exiting. And so if you have a bone spur that's pinching onto that nerve, then that may manifest with other symptoms. So that's when you may have pain, numbness, or tingling radiating down the leg. And that's called radiculopathy. So if you hear your physician talking about radiculopathy or using that term, again, it sounds scary, but what that means is the nerve is being pinched and may create some pain, numbness, or tingling running down the leg. So that's called radiculopathy. And that could also occur in your neck. So radiculopathy just means that the nerve is getting pinched. So for example, on this model, the spine is coming down and the nerve is coming out, but on its way out through that tunnel, it's getting pinched. And that could create the pain, numbness, tingling, or even weakness down your leg. So that's radiculopathy. So what can also occur in this situation is spinal stenosis. That's very, very common. We gave a lecture on that recently. And spinal stenosis is when the spinal canal gets narrow and starts pinching more and more on the nerves. So spinal stenosis and radiculopathy go hand in hand. A lot of times we'll get that nerve pinching and creating the symptoms down the arm or the leg, depending on what part of the body we're talking about. And this all occurs as part of a continuum. So disc degeneration, the disc wears down, the bones get closer together, we start developing bone spurs, or they're also called osteophytes, and then the nerves may get pinched. So if this is going on, how do we diagnose this? So one is you'll see your doctor, you'll give a history on what kind of symptoms you're feeling, and then you'll get an exam. So the doctor will test for different things. If they suspect this is going on, they may, if it's mild in its form, which generally it is, they may just recommend you to rest. They may tell you to take some ibuprofen to diminish the swelling. If it's more serious or something that's been going on for a while, we may order an MRI. So what's the MRI going to do? It's going to give us an actual picture of your spine to allow us to see what is the condition of the bones, the disc, the ligaments, the spinal cord, the nerves, and so on. So we can see if what we suspect is actually the diagnosis. So what we're trying to come down to is the diagnosis. I've given other lectures in the past, and you could see it on the YouTube listing, in terms of making a diagnosis before you even talk about a treatment. So we need to diagnose what the problem is. So let's say now we've gotten an MRI and we make our suspicion that the patient has degenerative disc disease, has some spinal stenosis, maybe has some radiculopathy. Remember, that's the symptom going down your leg, or if it's in the neck, coming down your arm. So the MRI helps us confirm. So then what? So if it's pretty severe, we may recommend some therapies. Sometimes physical therapy will help. How does that help? Well, these spinal models show the bones and the nerves, but they don't show the muscles. So surrounding the whole structure is muscle. If your muscles are weak and out of shape, then that's not doing your spine any favors. So that's why we would recommend regular exercise, and sometimes to help boost that and get patients in shape, we recommend physical therapy to help build up those muscles. If you build up the muscles, then that may help give support to your spinal structures to help less dependent on the discs and the bones to try to hold you up. Other things that are common to recommend is considering your posture, trying to sit up straight, keep your shoulders back. These are postures that are important to keep our spines in better alignment and in a neutral position. These days with the conditions of the pandemic, people a lot of times are working from home, have home offices or working on the kitchen table or in bed, and so our postures, our positions may not be optimized as they may be at work. So therefore I'm seeing a lot of patients with neck pain and low back pain because we're all kind of hunched over and we're not in the optimal position. So those are some considerations. So getting back to the diagnosis, we made the diagnosis. we recommended perhaps some physical therapy, and hopefully the patient's feeling better. We may recommend some anti-inflammatories like ibuprofen. That's a type of medicine that helps bring down swelling. So you may feel better with that as well. Then if that's not working, what's the next line of treatment? Sometimes we will recommend some injections. So that's when we're talking about like an epidural steroid injection. So that is basically where a pain doctor will put a needle aiming towards the nerves, but just outside, and they'll inject a little bit of steroid into that area where the nerve is. So steroid is an even stronger anti-inflammatory. That's a drug that's going to help bring down swelling even more powerfully, and hopefully that helps bring down the swelling and therefore the pain. But remember, most medications are just a temporary treatment. So this is a drug that will wear off, and so even if it works, over time it may lose its effectiveness. That's why you want to couple the treatment with something more long-term, like regular exercise, weight loss, core strengthening, and physical therapy. So hopefully with that combination, the patient's feeling better. Maybe modifying your work posture and your position, maybe changing your work, using a weight belt if you're lifting a lot at work, or trying to avoid certain things that aggravate your pain. Now, if those conditions aren't, if those treatments aren't working, then sometimes we'll consider surgery. So what do we do surgically? Well, it depends on the diagnosis. As you may recall, we've talked about how important the diagnosis is. That's more important than any treatment, because if you don't have the diagnosis right, treatments may not work. So surgically, it depends on the diagnosis. Let's say we diagnose that the patient has stenosis. That means the spinal canal is narrowing around the nerve. So then we could literally go in surgically and shave down some of the bone spurs, clean up the space around the nerve, make the tunnel where the nerves are traveling nice and smooth and clear of any debris like disc, like ligament, like bone spurs. So all that can be cleaned out to make space for the spinal canal for the nerves. So hopefully that relieves the symptoms. Now, we started out talking about degenerative disc disease. So remember, we talked about that being a condition where the disc is worn out and there's no cushion, there's no shock absorber between the bones. So the bones are rubbing, they're compressing nerves, that could be generating a combination of symptoms, and just shaving down those bone spurs when there's no cushion left sometimes doesn't help. And so at times you'll find that the spine is actually starting to slip. That slip is called a spondy or spondylolisthesis, when it starts slipping one in relation to the other. So that's a form of instability. Other times we may find that the spine is starting to tilt or twist a certain way. So that's a type of scoliosis. So now we're adding other terms, and you see how one term builds on another. So you may start out with degenerative disc disease. It may develop into a radiculopathy or a stenosis. But then now if you add multiple levels, and each of the levels of the spine are twisting or turning a certain way, so now you've got a type of scoliosis. And if you add that across multiple levels, you might find that you're actually feeling like you're shrinking. And that actually does happen. I have patients come to me and say they've lost a few inches of their total height. And you can see how that can happen if you're losing the cushion between your vertebral bodies, your spine, at multiple levels. You add that all up, and overall, we can actually shrink as we get older. The other complaint that I see sometimes are patients are reporting that they're crooked, that their hip is tilted one way or the other, their shoulder is tilted. So these are also signs of a scoliosis. So all of these things basically depend on the proper diagnosis, and then they all have various treatment options. If a patient has degenerative disc disease that develops into an instability, so that means the spine is unstable and it's shifting. And as it shifts, it creates back pain. So a lot of patients will report to me that they sleep, and when they wake up in the morning, they take 20 minutes to an hour to basically get warmed up. So what's that meaning is that they have severe pain when they wake up and they get out of bed. And that warming up is actually the muscles activating and trying to realign your spine and stabilize that core. Otherwise, the spine is kind of loose, and that shifting, again, is causing pain. And so that's why a lot of patients will wake up in the morning with severe back pain. So if this becomes a chronic thing and the spine is unstable, that's when sometimes we'll have to treat with hardware, screws, rods, plates, and that's when surgery is getting a little bit more complicated. So getting back to our number one topic today, we were talking about degenerative disc disease, developing into nerve compression, which is called radiculopathy. We talked about diagnosing the problem. How do we determine what this problem is? And then once we've diagnosed it, we talked about some of the treatment options like physical therapy and pain management, like injections, epidural shots. And then ultimately, if everything fails, sometimes we have to consider surgical options. So that's our discussion for today on degenerative disc disease and radiculopathy and spinal stenosis. I can point out some common questions that we get from patients. For example, am I a candidate? What is minimally invasive spine surgery, and am I a candidate for it? So minimally invasive spine surgery is basically trying to accomplish the surgical task with as small an incision as possible. Oftentimes we do it through a microscope, small incisions, and with minimal pain, minimal blood loss, and patients usually do very, very well. The recovery is quick. We have a lot of patients that go home the same day of surgery, and many others that go home within 24 hours. So you can do these types of surgeries we discussed, even spinal fusions, on a same-day surgery basis or even a 24-hour basis. Now, who's a candidate for minimally invasive surgery? That's a different story. So that's when you need to see an expert who does minimally invasive spine surgery and determines if you're a candidate. So some of the factors that we look at are how many levels are involved and how extensive a surgery it will be. So you never want to compromise the end result. In other words, if you can't do it through a small incision, then it shouldn't be attempted. It should be a larger incision, because ultimately you want an effective long-term result if you're going to have surgery. So it looks like we have a couple other questions. So one question is, can I treat spinal stenosis naturally? So the answer is yes. And I'd say the most natural way is building up your core, your muscles. And that's going to be non-surgical, no injections, no drugs. And that's just good old-fashioned exercise, weight loss, core strengthening. There are different ways to do it. Physical therapy, chiropractics, incorporating yoga, Pilates, all of these methods are fine. It's just whatever works for you. It's like any exercise machine. It's not going to do you any good if you don't use it and do it regularly. Same thing with strengthening core exercises, physical therapy. For some people, they love yoga or Pilates, Tai Chi. Any of those are fine as long as you do it several days a week on a regular basis, long-term. That's a good long-term treatment. Now, sometimes the stenosis is too far gone. It's too severe, and it may not respond. But it's always worth trying. The other reason it's worth trying is because even if you end up with surgery, you're going to recover better if you're in better shape. So it's always better to at least try some PT and core strengthening. We have another question, that is, how do we have spinal stenosis properly diagnosed? So the diagnosis starts with a proper history and physical. That means visiting your doctor and telling them what you're feeling, having an examination, and then they may suspect it and they may confirm it with an MRI to see if you actually have spinal stenosis and if the symptoms match what we suspect from your exam and your history. And we have another question. Are there factors such as age or lifestyle choices that increase someone's risk for lower back pain? That's a good question, and that's a good point, that age and lifestyle choices does affect our risk for low back pain. Now, there's a condition, there's a circumstance that you have no control over, and that's your genetics. So some people just have genetics that make them predisposed to have more low back pain, have other types of degeneration of the discs or the joints of your spine, and more prone to having back pain. So the genetics, unfortunately, there's nothing you can do about it. As far as age and lifestyle choices, yes. So age, as we get older, unfortunately, we do tend to degenerate our spines just like we degenerate our shoulders, our hips, our knees. The same thing happens in our spine. Now, the way you can try to counteract that is basically the same things we would say for a good, healthy lifestyle. Exercise, staying in a good weight class for your body, for your age, good balanced diets. All of this is important for our general health, for our brains, for our hearts, for our lungs, but it's also important for our core and our spine. So, and then the other element of lifestyle choices is the activities that we choose. So certainly it makes sense that somebody who exercises regularly and has a 9-to-5 job would probably have a different risk factor than somebody who's a professional weightlifter. So that severe downward pressure of weights is going to wear down your discs further. So certain activities are going to wear out our joints. We know that golfers will typically have lumbar 4-5 disc degeneration and wear out faster than others. We know that the weightlifters, wrestlers, people who ski will wear down their knees. So there are definitely some activities that are going to wear down our spines more than others. And those are choices. That's why some patients, they'll tell me, well, they really love to do a certain activity even though it may aggravate their back pain, but that's a choice. And if you choose to do that, it may precipitate the symptoms and then may require a treatment. So those are things that are lifestyle choices that you can decide. You can modify some of your activities. So if somebody works in a warehouse or in a garage and they're constantly lifting and twisting their backs, sometimes I'll recommend they wear a weight belt or a back belt that helps support their spine and remind them of proper lifting techniques and twisting. And those are things that you could also learn from the physical therapist. And I think we have a final question that reads, I have lower back pain. I walk approximately an hour a day. It seems like pain gets worse. Any thoughts or suggestions? So this is sometimes perhaps in a situation where a patient is doing all the right things. So perhaps the patient is in a good weight class for their body, for their size, for their age. Maybe they are not overweight, they're not underweight. They exercise, they walk an hour a day, and unfortunately they have back pain and it may be getting worse. So this is where we kind of want to reevaluate what we're doing and what the patient may have. We want a diagnosis. Okay, why do you have back pain? So I'll evaluate the patient, get a history, get an exam, and see maybe they have a hip problem, and they're putting them off balance and the back is hurting. Maybe there's something else going on. Maybe they have a history of scoliosis from childhood. If it's not clear, we'll get some films. So X-rays, MRIs are common. X-ray is going to show you the bones better, the structure, the health of the bone, whereas an MRI is going to show the soft tissues better, the spinal cord, the nerves, the discs, the muscles, soft tissues. So sometimes we'll get both of those studies to evaluate the health of your spine and then try to ascertain why do you have the back pain. Based on that, we may recommend different exercises or something that could be modified. So someone may walk every day and that may be great, but maybe we can add something to the mix, or we can change the way someone exercises at the gym, or some physical therapists do things differently. I wouldn't judge having perhaps one experience with a physical therapist, good or bad, as all physical therapists are good or bad. There's a spectrum in the therapists, there's a spectrum in the surgeons, doctors, teachers, lawyers, good and bad, and everything in between. So sometimes it takes trying different types of physical therapy and chiropractics and massage exercise regimens, modifying those things, and then getting films like an MRI or X-ray to try to figure out what the problem is. And then if those activities aren't working, then taking the next step. Do we need to try some injections through pain management? Do we need to try other conservative options? And then lastly, I want to keep surgery always as the last option whenever we can. Is there a surgical solution to the problem? So sometimes we have to get to that point. So with that, I want to thank you for your attention, your time. I want to welcome you to take a look at other videos that we have online and join us for the next lecture. Thank you.